From Denver 7, this is 7 News.
Well, October is Breast Cancer Awareness Month, and when women are faced with getting a mastectomy, the question is really, what's next?
Absolutely. There's a breast reconstruction technique being performed right now at Littleton Adventist Hospital, and it's done all in one surgery. So Dr. Lisa Hunsicker is joining us this morning. Hi. How are you?
Good morning. How are you?
Thanks for coming in so early this morning. We appreciate it. Talk about the traditional breast reconstruction and how your kind of single-stage reconstruction, how do they differ? What's different about it?
Well, traditional tissue expander reconstruction is a two-stage reconstruction. At the time of the mastectomy, we'll put in a tissue expander, which is a modified saline implant. After the patient heals, they come in for weekly visits, and that expander is expanded over time with saline, so it allows the tissue to stretch. Once that's done, then we take the patient back for a second surgery, and we take out the expander and put in a permanent implant. But I noticed over time that patients really complained that this hurt a lot, and it was very cumbersome to keep coming into the clinic for weekly visits. So I began to change this technique, and I merged my cosmetic breast reconstruction technique, or my cosmetic augmentation technique, with this. And so this allowed me to go direct to implant at the time of mastectomy. So patients are able to wake up fully reconstructed in a single stage. This allows them to achieve the physical outcome that they're wanting, but it also allows for the emotional aspect to be more positive, to wake up not missing anything.
Right, right.
So the emotional aspect, I think, can't be underestimated with a diagnosis of breast cancer.
Sure.
Absolutely. So what would you say would be the most innovative aspect to this approach?
Well, this simplifies the surgical process. The wonderful thing is it's a single stage. It's a very complex surgery, but it's getting right to the point at the time of mastectomy, so patients are basically waking up done. This allows patients to move through their cancer treatment much more quickly, but it also lets them get back to their lives.
And does it take longer? Is the recovery time longer because of this?
No, not really. It's actually a short overnight stay in the hospital. It's considered outpatient surgery. The risks are more or less the same. I've been doing this procedure for 8 years, and we've seen no more risk, but we're able to achieve this in a single stage.
Who would be the ideal candidate for this?
Well, the people who this is going to be most applicable to are patients who are just recently diagnosed with breast cancer and are considering a mastectomy. Another group of patients that we don't often talk much about are the breast cancer gene-positive patients. These patients are now considering prophylactic mastectomies as well. So it's for both.
Yeah, but that's positive news.
It's wonderful.
Not only have to just go in once instead of going in twice for all that. Dr. Hunsicker, thank you for coming in. We appreciate it. Good information for us today.
Thank you.